The swing machine technique for repair of iridodialysis is quite innovative and it's a little challenging. So here we present a patient with a dialysis and there is some amount of phacodonesis as well. So we are addressing both the repair of the iridodialysis as well as a subluxate cataract management. This is how the patient looks like. So after 2 side port entry, a good viscoelastic with 2 iris hooks supporting the iris, a round capsular excess is fashioned and a good hydrodissection is what is required. The capsular tension ring is the first to go to make the lens back complex stable. Irrigation aspiration to aspirate out the lens matter, which is quite soft here, and very gently, once the lens matter is removed, a single piece IOL goes and sits inside the bag. I remove the iris hooks and now is the time to use the swing machine technique. So quite evident in this animation is the swing machine technique where you are using the ninoproline, and this is how the 26 gauge needle comes as an aid, and finally all the loops, the suture is passed and a groove which is created, the knot can be buried inside the groove. So you can achieve a good pupil in these patients. So the peritomy comes first, partial thickness groove is created. This is how the ninoproline is tail tracked into the 26 gauge needle, and this 26 gauge needle would now act as a source of the ninoproline. So if you see here carefully, it is threaded through the iris and externalized. The suture is then withdrawn very carefully and a loop is created. So in this way, the 26 gauge needle bearing the suture again delivers the suture outside, and multiple such throws would help to create a good fixation of the root of the iris to the sclera. And then finally the ninoproline can be threaded through all the loops, and the loops can then be sutured and the knot can be buried inside the groove. A very good centration of the pupil can be achieved. As you see here, the pupil is very regular. There is a small amount of dialysis which can be seen and evident, but the lens is stable and a good vision can be achieved. Thank you.